Welcome back to HealthWise with our special guest, Dr. Albert Gros. Dr. Gros, we were talking before the break about different forms of pain management. There's one we didn't talk about pretty much, and I think it was neurostimulation, and that's the biggie. You know, that's the one that a lot of people, you know, are, like you said, it's a godsend. Can you tell us a little bit about that?
Absolutely. Neurostimulation comes in several forms, depending on where you're doing the stimulation. It's called spinal cord stimulation, dorsal column stimulation, and there are actually some uses for peripheral nerve stimulation as well. The scope of our practice tends to be more towards spinal cord stimulation. And basically what that is it's two implantable leads, basically some wires with contact points that we implant through a needle location in the back to a corresponding area that relates to where your pain is. So if you're having pain in your lower back in your right leg, we would implant the leads to the area on the spinal cord where this pain is basically projected. And then using a technology, which is a fantastic technology, there's electrical signals that are sent, which are current-based, which is important because it's less affected by scarring. And these electrical signals trick the brain. And again, that is a common theme about, you know, tricking the brain to some degree. And so what happens is as these pain signals travel through the nerves into the spinal cord, when they get to this common focal point where the stimulation is, the stimulator has distracted the brain by providing another sensation, one that's not a painful stimulation. It may be some patients describe it as a slight buzzing sensation. Some patients describe it as a constant pressure sensation.
Is it like, you know, I know, I remember a thing called a TENS unit where it was a little pack that sent a little, you know, signal to the muscles and it makes them jump or whatever. Is it similar to that, you know, as far as, I mean, the size, you know?
A little bit different. TENS units and muscle stimulators are meant to focus more on external stimulation.
Right.
And that technology is based on nerve distraction as well. But it's a little bit different principle. With spinal cord stimulation, you're actually stimulating points on the spinal cord itself. Right. So it's basically catching the pain signal on a pathway on its way to the brain as opposed to stimulating an external area to distract. So okay.
So is it portable, or is it something that they carry with them, or do they have to just get it done at the office every so often?
This is it's a procedure that's done in two stages. The first stage is done where we do it in our pain clinic office, and it's an outpatient procedure. You can expect to be there about 3 hours. There's nothing that's permanently implanted with the stage one. It's basically to see, is this going to help? So we would implant it. The sterile dressings are put over the device. Everything stays outside the body except for the leads, and the patient is given a remote control and they're taught how to use it. They keep it for 5 days, and then we see the patients back and determine whether or not it's a useful technology for that patient. If it is, then we bring the patients to the hospital at a later date and we implant a permanent. It was basically the same leads, except you get a pacemaker. So kind of like if you have a heart problem, you get a little pacemaker for your heart. Well, this is a little pacemaker for your spine. And it's implanted in the back near the site where we do the implantation.
Wow. Well, Doc, like I said, we've only got about 1.5 minutes left in the show, but is this something that would, I think you had said that someone that is having chronic pain that's on narcotics, this is something that they can look to maybe, which will get them off of this narcotics? And
absolutely. And in fact, the people that we use this technology for most is people who have either failed surgery. In essence, basically, they've had surgery and their pain was not corrected. And it's also for elderly people who are not surgical candidates. So if someone is a little too sick to have a big spine surgery. But it's also good for younger people who say, you know what, I'm really young and I don't want to have a big spine surgery. It scares me a little. This might be something that's a good procedure for that patient and may be able to avoid a larger surgery.
Okay. All right, Doc. Well, I see we're running out of time. So once again, thank y'all for joining us on HealthWise. And thank you, Dr. Gros, for coming and talk to our audience. And hope to see you again on HealthWise.
Thank you, Reggie.
Thank you.
HealthWise is brought to you in part by Opelousas General Health System.